Hi, I'm Katie Lutmer, and in this edition of the Aureus 411, Hannah Sacco and I will be talking about how to stay busy working consecutive assignments as a respiratory therapist traveler. So, to start us off, Hannah, why don't you give us some background on yourself?
Thanks, Katie. Hey, guys. I've been with Aureus Medical in the cardiopulmonary division for just under 3 years. I staff respiratory therapists all over the country, but mainly in the state of Illinois. I have been married for almost a year, and I have a 7-month-old daughter.
Awesome. So to get started then, why don't you tell us a little bit about what it takes to travel as a respiratory therapist?
Great question. So after a respiratory therapist graduates from an accredited university, they do need to pass their boards with the NBRC. Beyond that, they need to obtain a minimum of 2 years working experience in a hospital critical care setting.
So once the experience has been gained, what are the next steps?
Yeah, the next steps are really digging into where they want to work and where they have current active state licenses.
So you mentioned state licenses. What are some of the state licenses that every respiratory therapist traveler needs to have?
Great question. So every state requires a state license with the exception of Alaska. Some states see consecutive needs all year round. One of those is Illinois.
So talk to us about your Illinois assignments.
Great. So we see jobs all over the state, ranging from Chicago, Champaign-Urbana, down southern Illinois, near St. Louis, Missouri, really all over the map. We can keep people busy year-round.
Okay, so tell us about the experience requirements then to work in Illinois. What types of jobs do you see?
We see jobs ranging from small hospital settings, 25-bed critical access, all the way up to large teaching facilities in Chicago.
Now, what are some of the other things that are going to help open up a candidate for the different travel assignment options?
Yeah, absolutely. So in the state of Illinois, most jobs require the registry. So having the RRT designation is very helpful. Also, a candidate is most desirable for hospital positions in the state of Illinois when they're flexible. So being able to work in a smaller hospital, being able to work alone, being comfortable working in a large hospital system and using different types of medical software. These are all things that are going to make people more desirable for year-round travel jobs.
Awesome. Thanks, Hannah, for covering that information. And there you heard it. It is possible to stay busy working as a respiratory therapist traveler. State licenses are key for that, as well as your flexibility and experience on top of that. Stay tuned to the Facebook group, The Respiratory Therapy Connection. I post opportunities in it consistently where we have a lot of open needs. So if you're looking, this would be a perfect resource for you. Thanks, Hannah, for educating us on the state of Illinois, and we'll see you next time.